Hello, Slim and I are back to talk about the application of high energy to the spine in order to relieve previously diagnosed joint pains. In an earlier video, there were descriptions on how we inject for spinal joint pain and for sacroiliac joint pain. In some circumstances, however, the best result that we can get from injection is diagnostic. What I mean is that the relief from such injections might only last for several hours or maybe a day or two at best. So under those circumstances, we typically move on to what I call Plan B. Plan B is the application of high energy to certain locations in the spine using a specially designed needle. The idea is to disrupt the pain signals that are coming from the joint before they have a chance to reach the spinal cord and ultimately the brain, where those signals are felt as pain. The locations generally are either in the sacrum or the low back or lumbar spine, the mid back or thoracic spine, and the neck or the cervical spine. The specifics about the techniques will be described in the second part. The idea is to disrupt the pain signals that are coming from the joint or joints before they have a chance to reach the spinal cord and ultimately reach the brain, where those signals are registered or perceived as pain. Some people refer to this application of energy as radiofrequency. There are others who use the word denervation, but I don't care for that term. I think it creates a misunderstanding of what the technique really is. I prefer to simply describe this as the application of electrocautery to disrupt the pain. Now, in the next video, I'll be describing the specific placements of needles and the technique that's used during the procedure itself. The idea has been around for approximately 40 years. In the mid-1970s, this was introduced as a possible treatment for spinal pains, and over the next 20 or 30 years, it's gradually grown so that it's now a very common part of interventional pain management practices. There is a long history of safety and of efficacy. Typically, between 60 and 70% of the people who receive this procedure can expect relief of 1/2 or more than 1/2 of their pain, and the relief can be expected to last anywhere from 6 to 18 months. If necessary, it can be repeated